County Health Agency, we'd like to give you an overview how a Medicare savings account plan works. One, the plan deposits money into the member's medical savings account. The member decides what health services to spend the funds on and or save or invest the funds for future health needs. Three, the plan pays the Medicare covered Part A and Part B services once the member reaches their plan deductible amount. Fourth, the funds remaining at the end of the year belongs to the member and rolled over to the next year. To learn more about the MSA plan, let's go over to County Health Agency Learning Center. County Health Agency is not endorsed by U.S. government, federal Medicare program, Social Security, or any other government agency. Medicare savings account. What is a medical savings account? What is a Medicare MSA plan? Medicare savings account plan is with a private insurance company working with Medicare. These companies choose to offer a consumer-directed Medicare Advantage plan called an MSA plan. These plans are similar to a health savings account plans available outside of Medicare. You can choose your healthcare service and providers. MSA plans usually don't have a network of doctors, other healthcare providers, or hospitals. You cannot contribute money to the account. Medicare MSA plans have two parts. Medicare MSA plans combine a high deductible insurance plan with a Medicare savings account that you can use to pay for your healthcare costs. One, the high deductible. High deductible health plan, the first part is the special type of high deductible Medicare plan, Part C. The plan will only begin to cover your costs once you meet a highly yearly deductible, which varies by plan. Two, the medical savings account. The medical savings account, MSA, the second part, is a special type of savings account. The Medicare MSA plan deposits money in a special savings account for you to use to pay your health care expenses. The amount of the deposit varies by plan. You can use this money to pay your Medicare covered costs before you meet the deductible. What's covered? Medicare MSA plans cover a Medicare service that all Medicare Advantage plans must cover. In addition, some of the Medicare MSA plans may cover extra benefits like dental, vision, and hearing services. You may pay a premium for this extra coverage. Medicare MSA plans don't cover Medicare Part D prescription drugs. If you join a Medicare MSA plan and want Medicare drug coverage, you would have to join a separate Medicare drug plan. County Health Agency have many prescription drug plans. MSA plans don't charge a premium, but you must continue to pay your Part B premium. What are qualified medical expenses? Qualified medical expenses are generally the same types of services and products and otherwise could be deducted as medical expenses on your yearly income tax return. Some qualified medical expenses like doctor's visits, lab tests, and hospital stays are also Medicare covered services. Services like dental and vision care are qualified medical expenses but not covered by Medicare. Qualified medical expenses could count towards your Medicare MSA plan deductible only if the expenses are for Medicare covered Part A and Part B services. Each year you should get a 1099 SA form from your bank that includes all the withdrawals from your account. You'll need to show that you have had qualified medical expenses in at least this amount, or you may have to pay taxes and additional penalties. Using the MSA funds. Members can spend or save and or invest their MSA funds. MSA funds can be used for any expenses, medical or otherwise, but there are special rules on what expenses count towards the plan deductible and how they are taxed. Qualified medical expenses, QMEs, are defined by the Internal Revenue Service, IRS. All Medicare Part A and Part B expenses are QMEs, but not all QMEs are Medicare Part A and Part B expenses. Therefore, not all QMEs count towards the health plan deductible. Even though the MSA funds spent on any QMEs are tax-free, see IRS Publication 502 for a complete list of expenses deemed as QMEs. Examples of QME's non-Medicare Part A and B expenses: over-the-counter, dental, hearing aid, and glasses. Qualified medical expenses do not count towards the health plan deductible. QMEs that are Medicare Part A and Part B expenses, and they are expenses that account towards the health plan deductible: hospitalization, physician services, lab, x-ray, and imaging. Non-qualified medical expenses, food, rent, electronics, do not count towards the plan deductible, taxes as income plus a 50% penalty. This is not an exhaustive list. MSA versus other MA plans type. For Medicare Advantage, network access, HMO is limited and gated. And for PPO, you can have in and out of network. But MSA, you can go, there's no network. All Medicare protection providers are available to you. The members premium, low and higher premium for lower MOOP, and for the PPO, mid to high. And for MSA, the premium is always zero by law. Medicare Advantage cost sharing. For the HMO, is low or no OOP. Or for PPO, higher cost sharing. And for the MSA, it's 100% members up to the deductible, and the member pays nothing. The plan pays 100% insurance past the deductible. For maximum out of pocket, for HMO, the lowest is $3 to $4K, varies by premium. For PPO, normally at Medicare max of $7,550 for 2022. And for MSA, the equivalent maximum out of pocket is equal to the deductible minus the deposit. Let's talk. Applying for Medicare. Together we can help you find a plan that will meet your needs. Go to www.conradihealthagency.com or call us at 224-433-5754. Like us on Facebook, LinkedIn, Instagram, YouTube, Twitter, WhatsApp, and Google My Business.